Everyone, so this is Timothy Youngst, and I'm going to go over this week's interesting articles that I've been following. And actually, it's going to be a little bit different because we just had the almost completion of the Consumer Electronics Show, or CES, for 2019. And as you know, there's a bunch of products that always get released that's nowadays also focused on health. So I thought those would be interesting kind of to go over. One of them that there's a few that's also medication here, and so I'll start off with those. For instance, we have this called As Directed Plus, and this is a picture of the image. And it's quite interesting because if you look at it's app-based, it's synced and everything, and can track medication adherence, and it is a pill dispenser with trays, and it just comes out and shoots out. So this is a new medication adherence delivery system. I think it's relatively interesting. The question I have is, does it get filled by a patient, or is there a way to hook up with a pharmacy to have it dispensed into the system? I feel like most of those do that these days. Next was an announcement from Black & Decker. And Black & Decker is one of the investors in Pillow, and you guys probably heard me talk about these guys. It's a Boston-based startup. I like their system. I always compare it to if Alexa and a smart medication dispenser had a baby, and this is going to be their consumer model. It's going to be coming to the market called Priya. So I'm interested to see what the uptake of this will be. Next, I thought this was interesting. So this was announced, and I can't find the website for who makes this, but it's called the Chrono Life Vest, and it's supposed to predict heart attacks before it happens. So it's a French-based startup. I've seen like vest stuff come out a lot lately for patients, especially cardiology, to wear. And what gets me about them is, the obvious question is, which patients are you going to choose for it? Is this going to be like guideline-based therapy saying if you have a history, if you're high risk, you should wear these things? This data metrics, what's going to be the warning cutoff that, hey, this is definitely going on? This stuff's very interesting to me, needless to say, but the applicability, I think we're still trying to figure out where this stuff all falls in at the end of the day. But I think this is something that's coming down the pipeline as time goes on. Next is LOreal. If you follow LOreal, they've been doing a lot of interesting stuff with like these wearable devices. Some that you can just clip on that can detect what is the amount of sunlight out for the day and the risk for like SPF that you need to wear in order to reduce getting sunburns or causing your skin to wear. And in this case, they talked about a new one that can measure pH levels through the sweat. So you can see it's like a little wearable you put here. That's kind of cool. I'm wondering when the best time to use this would be. Is this when you go to the beach? Is this for, people who are working outside throughout the day? Most of the time they're models they use are women, but it's the company, I would suppose they go for skin and beauty. But I can see some applications for this beyond, I think, even just a simple consumer base. Next is Quell, which is talking about a drug-free pain relief solution that you would wear to help reduce pain. Now they have mentioned this is going to be for arthritic nerve pain, so it looks like to be like nociceptive osteoarthritic pain, but also along with neuropathic pain. So this is something that you use for diabetic neuropathy. I'm not too sure. What level of pain would you be using this for? I think that's, kind of a hard question there. But obviously, any use of technology to reduce pain is going to get a large amount of support, especially these days when we have this whole opioid epidemic occurring in the United States. And the question is, how can we reduce the use of prescription drug therapy, such as opioids, for long-term pain management? And, when we talk about back pain, that's one area that, if you look at the literature, there's so much out there saying it's not really a lot useful. Arthritic pain, a lot of OTC drugs used for neuropathic pain, foot pain, and others. If this is chronic pain, this could be a valuable solution potentially. I'd like to see more about this, especially the science behind there. Next is this Zander Accordion. Now, this is interesting because this is a device that you would like put on your bedstand or something that you can use to collect vitals. So you can collect resting heart rate, breathing rate. It can detect sleep analysis. and also can integrate with other systems to detect fall detection. This is interesting because they're going for a lot of AI and movement gesture control. And as you can see, it hooks up with different stuff throughout the home. And it's these home management systems. I'm going to talk about a few of those coming up as well that seem to have been huge at CES. Just kind of like this all-encompassing devices that you could put in a household. And if you've heard me talk in the past, my mantra right now is digital health. One of the big things is going to be using technology to keep people in the home and monitor them longer without having them to go into a facility. And I think people will pay money for that. The question is, what data is truly valuable? Who's monitoring, and how are they going to utilize it? So this is a solution coming out that is on my radar that I'm watching. Next is something called We Fight. So you can see right here it's popping up little questions and such. And it's like a voice assisted chat box with some AI in it. And I use data analytics that can do different support. In this case, We Fight is for breast cancer, and I know about them, and I've been watching them grow because Benoit Broard is a friend of mine that I talked to. He's based out in Europe, and he was with Withings in the past. He's a PharmD, so obviously I like to see pharmacists that are really taken to the next level for technology. This is something he's been working on. They were presenting at CES, so I really like the growth here that they've been doing. So if you haven't heard about them before, I would give them a look. Next, again, with home monitoring and such, this is vitals measurements. This one is a device that you wear on your wrist that mounts on your finger and collects vitals in real time. There's a bunch of these coming out to market. I've seen a lot of companies pushing this stuff. At the Connected Health convention, probably about 5 months ago, or 4 months ago, there was another one I saw as well. The implications for use of this, is large. Is this hospital grade equipment you could put in a hospital at some point? Is this stuff you can use for telemetry, real-time monitoring, something for home health care? I think there's a lot of opportunities here, and that's where this stuff is going. Next is test card. Now this was interesting because this is basically like a home urine analysis. So you have a card that you do your analysis with, and then through the app, basically does a camera analysis to tell you what's going on. That's cool. You can see this one's using for UTI. So where's this valuable? I guess hypothetically you could be having people store this at home, or they could buy it at a pharmacy and utilize, and then they could use it for testing services. I would see and envision that the logical conclusion would be that this data could then be synced up, that could then be transported to a clinician, maybe on demand, like a teleconsult. Maybe this is something that, all these tech companies are coming out with, like on-demand medical services through like Lemonade Health or something like that, would find interesting, because this could supply objective measurements that their clinicians could then use to prescribe services, and then have a pharmacy dispense medications to a patient as quick as possible. So these home-based testing services, I think, is going to see a big market growth here shortly, and finding ways to hook it up with a app, use the camera, whatever sensors or devices are available there that are low cost, that can then sync and supply data otherwise, I think is relatively good. Withings has come back, which I was surprised about, and if you've been watching with their whole debacle of Nokia and such, these guys have been, trying to, I think, almost reinvent themselves, and they released 2 new products. One is they have a smartwatch that has ECG on demand for a measurement of AFib, and needless to say, these days with the wearable market for smartwatches, you kind of need to almost have this service, just because with the Apple Series 4 watch, that was a big thing they were pushing. So I think a lot of companies are just, the logical conclusion is, hey, we measure heart rate in the past, that's cool, but now we got to take it to the next level, and the technology is slowly gravitating towards that point. And along with that was a new version of their blood pressure monitoring device. Now I have one. Let's see if it's here. Yeah, there it is. So this is the old one I had. I bought this probably about 4 years ago, and you would just take it, and then you would put it on your upper arm, turn it on, measure, sync to a smartphone, and it would take a blood pressure. it looks very similar, but you can see some differences because while this component here is where the batteries go, you just turn this here and there's batteries that will fall out. Here, though, in comparison, this is actually EKG measurement, and it's also tied here. So I think there's an image, if I can recall, down further. This doesn't have it. See if I click on ECG. I think there's a quick video that will load here, and it shows like the whole process. So relatively quick. As you can see, the person would use their arms resting it, and they would touch these different components for the ECG nodes to basically measure them for potential risk for AFib. And then along with that was the one node was to rest against your heart to listen. So it's like almost a stethoscope kind of thing. So really advanced. And again, this is, I come back to it, just playing this technology in a home would be useful. Next is a company called Kepler Vision Technologies. They showed this stuff at CES, and I was watching some videos, and you can visit them here and watch the video as well. It's a little longer, so I'm not going to play it. But what it showed was like watching and monitoring body language. And it's very interesting because you have these cameras in a patient's home, and you can monitor people. I think that's going to be relatively highly interesting just to see mobility. I mean, obviously falls prevention, but also maybe other disease stuff. This is probably going to serve as an interesting digital biomarker that, if we have clinical trials in the future, if they integrate this stuff, I think it'll be very, very, very high science. So I did talk about these guys for sleep apnea, and that was also fall, so had them later on. This is Wallabot, which is used as sensors you put throughout a home to basically capture and monitor falls. So, again, home systems that you would put in for a loved one, probably for a parent, and just monitor them. So, I'm curious if like Google Home and like with Nest and all that stuff they've done, if this is going to be something eventually they're just going to roll out their own version. I think that's inevitable. Next is a company, Intuition Robots. One of the things they released was this LEQ. Looking at it, it's a device that's used in the home to basically help out for connection with family members and such. But if you look at this thing, based on what I'm reading about it and what it does, it almost reminds me of the product from Propeller Health in terms of like a smart home bot. And I'd be very curious what the health aspects they may take on it. So these kind of things is very... I mean, the fact that it's supposed to hold conversations, and they seem almost animatronic. I mean, look at it in the background like that, just going. Catalia used something look more like a robot, had a face on it. This thing uses a very much, almost a minimalistic approach. One day I think we're going to see so many of these bots just in people's homes. I mean, me, for instance, I actually bought a little device called Vectors, made by Anki. And this little guy, yeah, he's so happy right now. I'll put you back down. I use him. He is a little bit, he rolls around my desk, and I can play blackjack with him. I can ask him what the weather is and talk to him. And, this is something for my own self-experimentation, just, what is the end goal for a lot of these products. I think it's going to be quite fascinating. Is there going to be a one product overall? Could a household have multiple little devices and such? So... yeah, it's kind of cool from that standpoint. VR, VR is such a big topic. This is VR Health, which was shown for different applications for training, education, and such. I'm not going to go in detail with these guys. I would say just look at them up and just see how is one company trying to use it for healthcare points. Now, there's some little bit of news. We saw Propeller Health got acquired by ResMed. They were at JP Morgan, and they were talking about COPD and the need for this technology. Along with that was news that Propeller Health is actually partnering up with Walgreens, using their app, so basically you can ask for refills of their drugs and such through them, or ask actually for pharmacist consult, which I think is relatively new, that I haven't seen that really pushed directly with a product service like this in the past, so I'm curious where that's going to go. Obviously, as a pharmacist, my biggest qualm about all this stuff is pay us. We're providing these services for practically for free at this point in time, so where does that go in the end of the day? Otsuka, there's some news that they have presented, basically reinforcing their whole strategy on using digital health to target mental health. And I talked last week about them teaming up with Click Therapeutics. We already know that they're with Proteus Digital Health with their Abilify MySite and other products. But the one line here that I thought was really interesting was the benefit of using the Abilify MySite. And this line I got was one thing that stands out to me was the number of patients which we did those studies in. The amount of data Otsuka collected was more than all the data we've ever had in our clinical trials, which is, if you track what Abilify MySite does with Proteus Digital Health, that patch can actually detect a lot of digital biomarkers and signs. And I think that's kind of the key thing is, when people are looking at this stuff, what is the data that you can collect and how can you utilize it? Health Beacon, if you don't know who they are, just received $12 million in the Series A round. They're an interesting company. I'll actually pull them up real quick. And they're one of the few companies I've seen that are really trying to tackle adherence in relationship to injectables. And what it is a smart disposable kit, at least the last time I looked at it. Here it is. So when you, it'll tell you when to take your medications and everything, and it gives you a medication score, and then you do dispose of stuff in there, and it can basically track adherence. So who's this good for? A lot of biologics, naturally, or injectable systems, but then also diabetes and such are also related. So that's where this kind of falls into play. Some studies. One was looking into AR technology for health literacy. This is more of a protocol feasibility study. It doesn't really give any clinical data, but it's interesting because they're trying to use this technology basically to help out with education for patients using AR through a device that you could basically track and see. In this case, you're looking at the use of an ARB and the information. So if a person was to scan that thing, then it can actually give them more information about their drug and what it can do, give them the library. I think that's cool. This is stuff I always feel like we should be having in a pharmacy or supply to pharmacy through companies for patients to get more information than pharmacists can provide at the time, or more education. Obviously, I think it would be really cool if we assign quizzes or other learning outcomes associated with that, and then we could reward patients for it. Maybe if we could say, well, you're comprehensive for this stuff, so we know in the pharmacy we don't have to offer you counseling except for maybe every twice a year, do a competency test. Do you know what this drug is for? If you do and you check off, you're good. And then within our systems, we know we don't have to offer counseling for this person. Maybe do this stuff at discharge of a hospital, especially for new medications, etc. I've been seeing a lot of interesting work coming out that. American Journal Health System Pharmacist, it was a publication using iPads and an app for that through, I can't remember what company it was, but basically to provide information and see how well you knew information. You can check my older videos and I go into detail about it. Other one, I was looking through Moby Health, but one publication I came across that's getting a lot of attention, I think it's going to take off more because there's different ways you can look at this. Basically, someone went through CBS data and looked at the top 20 or so digital health companies and their funding and what was the long-term aspects and how does it impact care. And I've been reading through this thing. A lot of companies they mentioned have kind of gone away. You see things in like Jawbone, Misfit with their Shine, which was a wearable I had in the past, and I lost that thing when I was on my honeymoon because it fell off in the ocean. Who knows, maybe a shark ate it swimming around with it right now. In any event, they kind of go into detail, but most of the stuff was a lot of wearables, and that's because they're hitting a lot of the early days from 2011 plus on collecting data for just health and fitness. So naturally they had a lot of funding back then. It was a different time period, so even the methodology here I'm a little concerned about, but I still think it's a relatively good paper, and I think it highlights almost some of the social economic differentiation between applicability of digital health and those who can afford the technology. You looked at all the stuff I talked about before. It's just things that you would put in your home. If you go to this stuff and you start looking at cost, it's out there. And when we hear about patients that have pulmonary disease and they can't afford an air conditioner in their home and they get symptoms and they get admitted to the hospital for that, well, the stuff's not going to make a difference. They have some bare necessities they need to afford first they can't even get. So what role is digital health even going to play for them? That's stuff that I think is very key, and I think that's going to be the next level of digital health that we really need to talk about in terms of if the whole benefit is scalability of care to the population. We really need to look at scalability of just the products themselves and who can afford them and use them at the end of the day. In any event, this is Timothy Youngs, the Digital Apothecary. Not too much this week. I think it's because CES and other things going on have shadowed a lot of publications, but I think there's some interesting news and some interesting products. So I hope you enjoyed this cast, and talk to you later.